Good afternoon, everyone. I am Dr. Almas Khan. I am a consultant surgeon at the breast surgeon and general surgeon at Cepheo Hospital, Wokhad Hospital, Masina Hospital, and Apollo Spectra Hospital. I am going to talk about breast cancer in general, things which you must know. So, anybody knows the incidence of breast cancer? The worldwide, it is the most common cancer in US, and now in India also it is the most common cancer. And but the thing is that early detection, the survival rates, 5-year survival rates are very good. So what are the risk factors? What are the risk factors which predispose to the breast cancer? So there are some modifiable risk factors and non-modifiable risk factors. So the non-modifiable risk factors is the gender. Basically, the women are more predisposed to breast cancer. Being woman is a greatest risk factor, but don't think like that the males won't get breast cancer. There's 1% breast cancer in males as well. So the other risk factor is the personal history of breast cancer. The person who has the history of breast cancer earlier will definitely again is at a greater risk of developing breast cancer or getting a recurrence. Then age. As the age advances, the risk of breast cancer is more and more. But nowadays we see much more younger women also getting breast cancer. So it's not like that older women only will get breast cancer. And the family history. I'm going to talk about the family history in little detail later on. But yeah, positive family history is a very important factor. So as I said, the modifiable risk factors or the other non-modifiable risk factors are the age of menarche and age of menopause. Like age of menarche means what age the girl attends menses or the menstrual cycle starts and what age it stops, menopause. So longer the cycle, they are more predisposed to get cancer because of the high level of estrogen and nulliparity, not having children. That's again a risk factor, or not breastfeeding. That all this is related to the hormonal balance of the body. Or the modifiable risk factors are patients, the people who take OC pills or the oral contraceptives are more prone to get breast cancer. And alcohol and smoking, the lifestyle factors basically, which is very common these days. So the smoking is a greater risk factor. Alcohol is again a very good great risk factor. Obesity is again a risk factor which predisposes to the cancer. And history of any radiations for anything else. Now we're going to talk about some myths and the facts of breast cancer. So what people think that only older women get breast cancer. As I said, younger women nowadays also getting breast cancer. We see women in like 25-30 years also getting the breast cancer. So it's not that the only women who are 50, 60, 70 will get breast cancer. So that's a myth. So important thing is to self-examine yourself and have screening by the doctors or by the mammograms. Another myth is that if a woman has family history only is a great risk factor and others will not get. Every woman is at risk of getting breast cancer. Having breast itself is a risk factor for getting breast cancer, being a woman or a man. Even in men, there's 1% chance that they will get breast cancer. As I said, that people think I'm too young to get breast cancer. That's not true. Women under 40, like I said, 25, 30s also receive breast cancer. Men think that they can't get breast cancer. That is again not true. As I said, 1% chance, 1 in 1,000 get breast cancer. Alcohol is not linked to the breast cancer. Absolutely not true. Alcohol is a very big risk factor for development of breast cancer. And only women, as I said, the family history, no. Others also, in fact, 75% of the cancers, breast cancers, are not related to the family history. They are not genetic. So only few, very little percentage of breast cancers are familial, or we can say like it runs in the genes or in the mutations in the gene. And people think that the cancer, not even breast, every cancer is a death sentence. That is absolutely not correct. If cancer is detected at an early age, it is diagnosed in a very early age, it is 100, at least breast cancer is 100% curable and treatable. And even if it is detected in a later stage, it is treatable. Even if it is stage 4, it is not 100% that the patient is going to die in some days. So please stop making it as a death sentence and start treating it. If the people think that if they have a bigger breast, they will get a cancer. That's not true. The size of the breast is not relevant to the development of the cancer. The breast lumps, every breast lump is not cancer. In fact, 9 out of 10 breast lumps are not cancers. So don't get scared. Don't think that I have developed a lump, I will not show it to anyone because it's going to be a cancer and I'm going to die with it. So don't hide it. That's the stigma around, and that's how people hide it. People think that women with breast implants cannot undergo mammograms. They can undergo mammograms. Only thing we have to take special precautions for them, and special mammograms are arranged for them. So that is why they need to inform the technician, inform the place where they're getting the mammograms, so that the special requirements are fulfilled and the special plan is made for them. Breast cancer is contagious? Not at all. No cancer is contagious. It cannot spread from one person to another. So please don't think that the cancer is contagious. And if there is somebody who's having cancer around you, breast cancer around you, you need not isolate the person. You need not, in fact, they need the care and the special bond with you, the family, the friends, everybody around, so that they have the courage to undergo this and they have to face this problem and get over it, tide over it. Yeah, I get these questions a lot of time about bra. Wearing a push-up bra increases the breast cancer, or some forwards they see that wearing a black bra in summer will cause breast cancer. Wearing a bra at night will cause breast cancer. This is all not true at all. No cancer develops like that. So that is, please do not believe in those things. Now, it's not that the only risk factor, people who have risk factor will get cancers. It's not at all true. Anybody can get cancer. As I said, having breast is a greatest risk factor for developing a breast cancer. If you have one or more of the risk factors, then yeah, you are at risk. You are at more risk than the general population. That is it. So then now, what will you think that how do I know that I have a cancer or not? So these are the basic signs and symptoms of breast cancer. A visible lump in the breast or in the armpit or the axilla, what we call it as. So there is a lump in the breast which can be small as the size of a lemon, or if you notice if it is the size of a ball, or maybe a peanut or something. So lump you cannot ignore at any age. Don't think that I'm too young, it can't be anything. It's just like a fat nodule or something. Don't ignore. Please seek help. Please immediately go to the doctor and follow the advice. Don't self-diagnose and start treating it with home remedies and stuff like that. And other changes in the breast, like dimpled or depressed skin. Skin at one point get puckered up. That is that's one more sign that there could be a lump underneath which is tethering the skin, which is pulling up the skin. Swelling at one particular point in the breast, like skin is changing, it looking like a orange peel kind of appearance called pode orange. So that is another sign that there could be underlying lump. Nipple changes. The nipple become thick. Sometimes it goes inside, it becomes retracted, which was otherwise normal, and now it has gone inside or getting pulled up in the breast. So there's a lump underneath which is pulling it up, or there is a nipple discharge, A bloody nipple discharge cannot be ignored. It's a very, very alarming sign that there is something going on in the breast which is not correct. Pain in the breast, okay, or feeling heavy, or any skin irritation, or textural changes in the skin of the breast or in the nipple areola. Sometimes it becomes very dry, it looks like a eczema kind of a thing, which could be cancer. It's called a Paget's disease of the breast. So please do not ignore. If any one of the signs also is present, you really need to immediately show. All this is basically showing the skin texture changes or the nipple discharge, how the armpit pain or the swelling will appear, any dimpling on the skin or puckering, size or shape change, recent change in the size of the breast or shape of the breast, any redness or rash develop recently, or like the swelling which has happened. I said the pod orange or the orange peel kind of a appearance of the skin, or lumpiness or thickness in one particular area of the breast, and of course the nipple which is pulled up, which was normal otherwise. So what will you do if you see all these things? This is all alarming. You really immediately need to visit your doctor. Show that, doctor, I face this thing, 4 days I'm feeling this, like, kind of a lumpy thing in my breast or like in my armpit or something like that. So first I would like to discuss a little about the stages of breast cancer. So what is stage 0? Stage 0 is only inside the glands. There are no, it's not very well visible. Sometimes on screening mammography we find it. It's only not even palpable in the hand. You can't feel it also, but it just detect on the mammography or sonography when we do it. So these cancers are have got absolutely amazingly 100% survival rate, because they are not even come to any centimeter size, so they are 100% survival rate. Then what is stage 1? Stage 1 is less than 2 centimeter size tumor and not gone into the lymph nodes in the armpit. The cancer in the breast goes into the lymph nodes in the armpit, and that's how it spreads to the other parts of the body through the lymphatics. So it is confined only to the breast, not gone in the lymph nodes. So again, the survival rate is very good. The 5-year survival rate in stage 1 cancer is almost in the tune of 95 to 100%. What is stage 2? Stage 2 is tumor size 2 to 5 centimeter. Lymph nodes might be involved or might not be involved, and it is confined to the breast, not gone to the other parts of the body. Again, the survival rate in this case also is pretty decent. It's around in the tune of 90%. What is stage 3? Stage 3 and stage 4 are very not good to have. So that's the aim, that we are motivating people not to wait till the stage 3 and stage 4 is reached. Please seek help immediately as soon as you find it. Don't wait for 2 months, 3 months, 6 months, and don't let it become like a big affair later on, and it's not very easy to treat these cancers. So stage 3 is a large tumor more than 5 centimeters. The skin is involved, as I said, all those changes, the puckering, dimpling, and the oranges appeared. The lymph nodes, there's a big swelling in the armpit, axilla, and it has reached, the tumor has reached the above skin or the underlying muscles. But this stage 3 cancer doesn't go to the other parts of the body. So the other parts of the body where the breast cancer goes are usually liver, lung, brain, or bones. So this stage 3 cancer has spreaded to the breast but not gone to the other organs. Again, the survival in this case is in the tune of 60 to 65%. Stage 4 cancer is the last stage of the cancer. And generally people come and ask what stage it is. They like to know what stage it is. So in mind also they know that the survival rate of these cancer is this percent. So stage 4 is a very bad cancer to have. It's the last stage. That means it has gone any size of the tumor, but it has already gone into the other organs like liver, bone, brain. This patient might present as bone pains or the backache, or present as epilepsy, like a fits, you can say, or any abdominal pain. The liver has got a metastasis or the lumps. Survival rate, 5-year survival rate in such cases is almost like 20 to 22%. We can have a good quality life with the palliative treatment, but in this case, the cancer cannot go out of the body. We cannot cure this last stage of the disease, but the rest of the 3 stages are 100% curable. The survival rates vary depending upon the stage. So that's why I am emphasizing on early detection. Early detection saves lives and save the breast also. Earlier the stage, smaller the tumor, we are able to do the surgeries, newer surgeries, in which we need not remove the entire breast. We can preserve the breast. We do the conservative surgeries and remove only the lump and the lymph nodes in the axilla, and the person is happy because there is a breast which is present in a woman. It's a very important organ. There are a lot of mental problems along with mastectomies, like you get depression thinking about that I'm going to lose a breast. It's not an easy task to decide upon. So if it is detected early, if you find it earlier stage, even the survival rates, you can see it, how wonderful it is. 100%, like you're living a normal life, you're not a patient anymore. So that's the thing. So now what? Like if you found there is a lump, if you seek the doctor will advise you for investigations. So what are the investigations for detection? There are different modalities. Basically we call it as any lump in the breast, we call it as triple assessment. Triple assessment involves the clinical assessment, the radiological assessment, and the pathological or the histopathological tissue diagnosis, we call it as. So the clinical examination is done by the doctor. He's detected it, like there is a lump which looks suspicious to me, but only the clinical suspicion cannot give you the 100% diagnosis of cancer. It could be something else. So we need to, it's a multimodal detection modality, you can say, the investigations. We need to do the radiological investigations and some tissue diagnosis. So radiological investigations are the mammography, the ultrasonography, the MRI of the breast. So mammography, everyone must have heard about mammography screening. Mammographies are going on, but word of caution, younger women less than 40 years should not undergo mammography because the density of the breast is very high. So the tumor's density and the breast density is almost equivalent. It's not easily detectable on the mammography, X-ray mammography I'm talking about. In the mammography, what they do, X-ray mammography, they press the breast under the 2 slices and take a X-ray. It's like a kind of a X-ray. X-ray radiations are given, X-rays are given, and then the lump is detected. So what we can see on X-ray mammography, there is a spiculated lesion with microcalcification. Small dot-like things will appear. It will be like a star kind of a thing which will be seen on the X-ray, and small calcifications will be seen, which signifies there is a cancer in the breast, which is giving indication that there is a cancer. So there is a system which classifies as, we call it as BIRAD system. So BIRADS 1 is negative, BIRADS 2 is benign findings, that means it's not cancer. BIRADS 3 is probably cancer, probably benign, don't know. Stage BIRADS 4 is highly suspicious of cancer, and BIRADS 4 is already diagnosed, and after that if we do a mammography, that they don't know that it's a already known case of cancer. So mammography should be done with very cautiously after 40. Yeah, of course you have to do mammography. Without that we cannot just diagnose it. Ultrasound of the breast is mainly for the younger women. We do routinely mammography and ultrasonography for every patient nowadays for the detection, but younger than 40 we do only ultrasonography. So please do not undergo mammography just randomly like that in a younger women. MRI of the breast is for special cases. Not every case should be undergoing MRI of the breast. There are few specifications or few indications in which patient undergo MRI of the breast. So now we move on to the, so again, if there is a suspicion of lump or cancer on the radiological investigations, then what we do? We undergo a tissue diagnosis. How do we do a tissue diagnosis? Tissue diagnosis is basically we remove a small part of the lump and send it for examination so that we know that what are we dealing with. First modality is FNAC, or called fine needle aspiration cytology, in which a very fine needle is put in the tumor. Around 24 gauge needle is put in the tumor, and we remove only cells are removed in this, and we put it in the slide and seen under the microscope. This modality is not a very a specific investigation, not a very 100% reliable test, because sometimes we don't see, only cells come. Sometimes it doesn't hit the tumor and the tumor cells are not seen. That doesn't mean there is no cancer. If it's a suspicious thing, we need to investigate or evaluate further. Plus, it cannot give the hormone receptor studies which are required for further treatment. So FNAC is not a very good investigations to go for. So what we advise is to undergo true cut biopsy or a core cut biopsy, it's called, in which little small part of or maybe a few millimeters part of the tumor is removed with a special gun, and it is done under the local anesthesia in the OPDs and sent it for histopathological examination, in which we see the tumor cells, what type of a tumor it is, and what are the hormone receptor studies. Because in some stages of the disease, we are not opting for the surgery directly, so we need to know the receptor studies prior only. Okay, and what are the other investigations? As I said, the investigations are done according to the stages of the disease. If it's a small tumor, stage 1 or stage 2, we need not do the metastatic workup. Metastatic workup involves that seeing the other organs of the body if they are involved by the tumor, by the cancer. So, how do we see the other organs? If it is a stage 3 or a stage 4 cancer, we think that there could be metastasis. It's a very big tumor, or the patient's having backache or some weird symptoms which signifies that it could be a metastasis. Then we need to do metastatic workup, in which we can just do a ultrasound of the liver or the CT scan of the chest or CT scan of the brain. But if we want to see the entire body, the best treatment modality, the investigation modality is PET CT scan, the positron emission tomography it's called. It's a radionuclide scan which shows the entire body, and the tumor activity is detected by giving the radionuclide substance. So if there is any activity in the lung, liver, anywhere along with the breast, it is seen on PET CT scan, and that's how we know that it has gone to the other organs. It's a stage 4 cancer, and the treatment changes completely. Alright, so what are the treatment modalities? We go on the treatment modalities now. As I said, that the detection is also multimodal. The treatment of any cancer per se is multimodal. That means not only one type of a treatment modality can be used for the cure of the disease. So what are the different modalities? First is surgery, chemotherapy, targeted therapies, it's a newer therapy, hormonal therapy, and radiation therapy. So when you all are confused, surgery, chemotherapy, what should I be doing, which therapy should I be doing, which should I undergo surgery, can it be done without surgery? A lot of questions people come with, and the patients are very apprehensive about some or the other part of the therapy or the treatment modality. But if you want to achieve the 100% survival, if you want to cure your cancer, you have to do multimodal treatment. If it's a stage 1 and stage 2 disease, that means a small tumor, confined to only breast or lymph nodes less than 5 centimeter, that the upfront surgery, like the first treatment modality would be your surgery. And after that, depending upon the size of the tumor which we see on the report, the chemotherapy is offered, the targeted therapy. As I said, the hormonal receptor studies we do, which is a special test which we do to see if the hormone receptors are positive. The ER, estrogen receptor, progesterone receptor, and HER2 receptors are positive. Then we do targeted therapy and hormonal therapy. Hormonal therapy is given for 5 to 7 years. So if these patients are not positive for hormone receptor, it can be avoided. So that's the importance of doing, because some people have doubts, why should we do such an expensive test? Why do we need to undergo this? Because that treatment plan is dependent on these tests. That is why you need to undergo. The other part is radiation. I will tell you the indications of radiation. So first we go for surgery. What are the surgeries? Surgeries for breast cancer are many, but two important parts are modified radical mastectomy and breast conservative therapy. In patients which have to undergo surgery, which are small tumors, and if it is less than 2 centimeters, less than 4 centimeters, depending on the breast size, we offer them breast conservative surgery in today's time. MRM or modified radical mastectomy involves the removal of entire breast and the axillary lymph nodes. We can do reconstructions and all, but why to remove breast when we can preserve it? So early detection can only achieve this, the breast conservation or the preservation of women's breast. So that is why medical mastectomy or the MRM, in which there are indications where people cannot take radiation therapy, and because breast conservative therapy involves compulsorily giving radiation. So there are indications where patients cannot take radiation and things, very old patients and like that, then we offer them MRM or modified radical mastectomy directly. But in younger women who are keen to preserve the breast, who are ready to take radiation, because if they don't take radiation within the breast conservative therapy, they will have recurrence. The disease will not be cured 100%. They have to take radiations. So what we do in breast conservative therapy is remove the part of the breast, only the quadrant or the lump around, or a little area of the lump, and the axillary lymph node. And after surgery, we give them radiation or the radiotherapy. After that, depending upon the stage of the tumor, the chemotherapy is offered and the targeted and hormonal therapy that goes on. So what are the other indications for chemotherapy are where it's a stage 3 tumor, where surgery upfront is not possible. First surgery is not possible. It's a very huge tumor. It's not possible to remove it. Even if after removing the entire breast, we will not get the margins which are clear. So we give them chemotherapy first. Give them few cycles of chemotherapy, downstage the disease, reduce the burden of the tumor, and then offer them surgery. Many cases the tumor regresses so beautifully that it's almost gone. Then we remove only a small part. We can do the breast conservative therapy also in such cases. And we give the remaining chemotherapy and radiation after that. Stage 3 cancer 100% requires post-op chemotherapy and post-op radiation therapy. And again, depending upon what report comes of the hormone receptors, we give them hormone therapy and the targeted therapy, which is a newer therapy. The other modality is the chemotherapy. The indication of chemotherapy is in the case of stage 4 disease, that there is a metastasis that's already gone to the other parts of the body where it can't be removed from. Okay, so then there we give them chemotherapy, palliative chemotherapy we can say, or just to have them good quality of life and a little suppression of the disease burden or the tumor burden, so it doesn't grow furthermore and stops at that, so that the chemotherapy helps in such patients. And radiation therapy is given, as I said, post-operatively along with breast conservative therapy. It's 100% must thing to give. Secondly, even if we do MRM or the entire removal of the breast, if many lymph nodes are positive or a very large tumor size, more than 4 centimeter size, or more than 4 lymph nodes are positive, we offer them radiation therapy. It's a must to take. Again, if there is a stage 4 cancer in which the cure is not possible, surgery is not possible, and if the patient comes with a lot of backache or the brain tumor, brain metastasis, the tumor from the breast has gone to the brain or the bone, we can give them radiation so that the tumor cells are killed over there and the patient is symptomless or becomes better, doesn't develop the other symptoms, or the tumor regresses in the brain. As I said, the hormonal therapy is given for it's a very easy treatment. There are tablets available which are given for 5 to 7 years. And the targeted therapy is a new therapy which has got a very wonderful survival rate benefit. That is why it is offered to the patient along with the chemotherapy. So as I said, the survival rates, the stage 0 and 1 is close to the 100%. As we say, it's wonderful, 95 to 100% survival rate, 5-year survival rate. Stage 2 is in a tune of about 90%. Stage 3 is about, like I said, 60 to 65%, 70% they say. And stage 4 is, I said, 20 to 25%, 22 to 22% is the 5-year survival rate. But that doesn't mean we don't treat stage 4 tumors or stage 4 cancers. Don't think that इसका कुछ नहीं हो सकता. We are not going to do anything. अब तो इसको छोड़ दो ऐसे ही. हमको ये नहीं करना है. We have to treat these patients as well. Okay, even if they have spread it to the other parts of the body, we can help them. We can offer many modalities like chemotherapy, radiation. कुछ ना कुछ देख के हमको उनको ठीक करना है, उनका क्वालिटी ऑफ लाइफ को अच्छा करना है. There are many options available. So what are the 3 tiers of early detection? See, I'm emphasizing so much on early detection because breast cancer में early detection, in any cancer, early detection has got a very, very high benefit and we want that. Okay, so first thing is self breast examination. I'm going to talk about self breast examination in detail. कैसे करना है, how to do it, what all things are there and when to do it, कब से किसको करना है, who all are eligible to do self breast examination, everything I'm going to talk about. Second is clinical examination. डॉक्टर के पास जाके आपको कब चेकअप कराना है, when you think you should visit a doctor and do a clinical examination with your doctor so that you know that you are not having any cancer. And other investigations like mammography, screening mammography. कब mammography करना है, लंप है नहीं है फिर भी आपको mammography करना है, क्यों करना है, कब करना है, I am going to talk about it. Early detection, better outcome, better survival rate. So as I said, I will be talking about the role of family history, because people think family history is like 100% family history है तो हमको हो ही जाएगा, and it's not that. Everyone knows this, who this is. It's Angelina Jolie. I'm sure सबने पढ़ा ही होगा what is it about and why is she important and what has she undergone and everything. So what is family history? आपके घर में अगर किसी को कैंसर हुआ है, ब्रेस्ट कैंसर और ओवेरियन कैंसर स्पेसिफिकली, आई एम टॉकिंग अबाउट ब्रेस्ट कैंसर, तो रिस्क कब है ब्रेस्ट कैंसर होने का? When one person, one first degree relatives में आते हैं आपकी your mother, your sister, your immediate aunt, mother's sister or mom, mother's mother, grandmother. maternal grandmother. ये लोग को अगर आपके घर में किसी को भी लेस देन 40 years में ब्रेस्ट कैंसर हुआ है, देन यू आर एट रिस्क ऑफ डेवलपिंग ब्रेस्ट कैंसर. 60, 70, 80 years में हुआ है एक जन को, तो दैट इट्स नॉट अ वेरी सिग्निफिकेंट फैमिली हिस्ट्री. वी आर एम्फेसाइजिंग ऑन सिग्निफिकेंट फैमिली हिस्ट्री. हर एक को, किसी को भी घर में आपकी सास को है, ससुर को है, दैट्स नॉट significant family history. Significant family history is one or more first degree relatives having breast cancer or ovarian cancer less than 40 years. More than 2 second degree relatives having breast or ovarian cancer. Either of it. आपके second degree relatives are your cousins, your other nani's sister, your mother's sister's cousin, like that. Those people, or your cousins, your mama's daughters, all these are, I'm talking about, this is a maternal history is important. Maternal side of a family is important in developing breast cancer. So if anybody has breast cancer in all these people, then it is a significant family history, then you are at risk. So what is the risk? Why is it? What is it? What causes the breast cancer in the families? So there are things like something called genes or the genetic mutations which cause the breast cancer. There are genes called BRCA1 and BRCA2, BRCA1 and BRCA2, which cause the breast cancer. If there is a genetic mutation in any of these genes, then the person can get breast cancer. सो एंजेलिना जोली जी को इनमें से एक जीन में म्यूटेशन था, तो उनको पता था कि उनको लाइफ में कभी ना कभी ब्रेस्ट कैंसर होगा. शी इज एट रिस्क. इट डजंट मीन कि वो दैट रिस्क इज नॉट 100%, बट शी इज एट अ रिस्क विच इज हायर देन द नॉर्मल पॉपुलेशन. बाकी सारे लोगों से इनको ज्यादा रिस्क है. शी इज एट अ हायर रिस्क ऑफ डेवलपिंग ब्रेस्ट कैंसर. एंड इफ यू हैव अ वेरी स्ट्रॉन्ग फैमिली हिस्ट्री, जेनेटिक ये पॉजिटिव आए हैं जीन्स, then what should be done? Something called genetic counseling can be done. इन लोगों के लिए काउंसलर्स होते हैं. You have to go to them. They will tell you everything about कि ये जीन्स अगर पॉजिटिव आए हैं तो वो आपको बताएंगे कि समझाएंगे कि ऐसा, मतलब people are very apprehensive once they get to know that it's a genetic thing, or they are more predisposed to getting a cancer. तो ये सबको डील करने के लिए they need to go to the genetic counselors, where they tell you that what to do about it now. Now when to start screening, because these people require screening in the form of self breast examination, screening in the form of mammographies or like the clinical examinations. When do they start screening? When they should start screening? अगर किसी के घर में उनकी मम्मी को या किसी को कैंसर हुआ है एट द एज ऑफ 40, देन दे शुड स्टार्ट स्क्रीनिंग 10 years प्रायर टू द एज ऑफ इंडेक्स पेशेंट. मतलब 30 साल की उम्र में उनको स्क्रीनिंग स्टार्ट करना है. क्या करना है? सेल्फ ब्रेस्ट एग्जामिन करना है हर महीने. गेट अ एनुअल चेकअप बाय द डॉक्टर एंड द एनुअल स्क्रीनिंग मैमोग्राफी. जब तक वो 40 के नहीं होते, दे हैव टू डू अ सोनो मैमोग्राफी एंड लेटर ऑन दे कैन गो फॉर अ एक्सरे मैमोग्राफी और डिजिटल मैमोग्राफी. ओके, अब ये सब करते रहना है उनको. कब तक? जब तक के एटलीस्ट वो 60 years के नहीं हो जाते, तब तक उनको करना है. Some say that they have to do it once in a year, some say once in 2 years, but they have to do it. The screening is very important, at least for the patients, people who have strong family history of breast cancer. Screening per se in general population also I'm going to talk about कि उसकी ज़रूरत है या नहीं है. लोगों के दिलों में एप्रीहेंशन रहता है कि मैं ये करूं या नहीं करूं, मुझे कैंसर हो जाएगा. तो स्क्रीनिंग के कुछ फ़ायदे भी हैं, कुछ नुकसान भी है. ओके, तो ये रही इसकी बात. नाउ वी आर गोइंग टू टॉक अबाउट the facts, some numbers and the facts. 1 in 8 women will be diagnosed with breast cancer in worldwide. Okay, हर 2 मिनट पे एक औरत को ब्रेस्ट कैंसर होता है. breast cancer is the most common cancer is in USA and now in India as well, which was second in the list, with the cervical cancer being the topmost, but it's almost reaching the top now. And what can we do about it now? अभी सब लोग आते हैं कि मुझे कैंसर हो जाएगा, क्या मैं क्या करूँ, what will I do, how can I avoid it? See, the non modifiable, जो जिनको हम नहीं बदल सकते, like हमारे being a woman we cannot change it, then being a age you can say, age तो बढ़ती जाएगी, उसको तो आप रोक नहीं सकेंगे, that these factors we cannot help. आपकी कब एज ऑफ मिनार्की थी, कब मेनोपॉज होने वाला है, यू कैन नॉट हेल्प दैट, दिस इज ऑल नेचुरल. तो उनको आप चेंज नहीं कर सकते हैं. फैमिली हिस्ट्री है, उसको आप चेंज नहीं कर सकते हो. उसके बारे में क्या कर सकते हो, आई एम गोइंग टू टॉक अबाउट इट, कि जिनकी फैमिली हिस्ट्री है उनको क्या करना है आगे. वो लोग को अगर बहुत ही स्ट्रॉन्ग फैमिली हिस्ट्री है और लोग जेनेटिक काउंसलिंग कर चुके हैं तो उनको आगे ट्रीटमेंट ऑप्शन क्या है. दूसरी बात कि जो मॉडिफाइबल रिस्क फैक्टर्स है उनको हम चेंज कर सकते हैं. लाइक आजकल ट्रेंड है कि पीपल डोंट वांट चिल्ड्रन, नली पैरिटी, दे डोंट लाइक टू फीड, ब्रेस्ट फीड. ब्रेस्ट फीडिंग इज बिकम लाइक ऐसा नॉट अ वेरी कूल थिंग टू डू. तो वो हम अवॉइड कर सकते हैं कि हमको बच्चों को, वी नीड टू हैव चिल्ड्रन, ब्रेस्ट फीड देम, ओके. गेट मैरिड एट अर्ली एज, not early but appropriate age, I can say. Exercise, lifestyle changes, we can reduce weight, stop smoking, drink less alcohol and exercise more, and do the annual mammographies. Okay, so I will have a word about the people who are BRCA1 BRCA2 positive, genetic mutations जिनमें present हैं. वो लोग क्या करें? वो लोग, there are many options available, like there is, depending upon the genetic mutation and the age of the patients, the people, हम उनको कीमोप्रोफिलैक्सिस यानी दवाई से कंट्रोल कर सकते हैं कि उनको कैंसर नहीं हो आगे चल के. there are few tablets which are hormonal tablets which are given, there are few medicines which are given कि उनको आगे चल के कैंसर ना हो. और जो एंजेलिना जोली जी ने किया है कि उन्होंने दोनों प्रोफाइलेक्टिक बायलेटरल मेस्टेक्टमी, मतलब दोनों ब्रेस्ट निकाल दिए हैं और वहां पर इम्प्लांट्स या फिर दूसरा प्रोस्थेसिस डाल दिया है. तो ये कर सकते हैं, बट दिस कांट बी डन इन अ यंगर विमेन हु आर नॉट इवन फिनिश देयर फैमिलीज. ओल्डर विमेन के लिए ठीक है, लेकिन जो उनको अभी फैमिलीज चाहिए, उनको अभी बच्चे चाहिए, उनका अभी पूरा लाइफ का वो बाकी है, इट्स नॉट वेरी इजी टू अंडरगो बायलेटरल प्रोफाइलेक्टिक मेस्टेक्टमीज फॉर देम. So these are the treatment options, or it's not a very easy, you can say, a task to just like think and undergo. There are a lot of issues involved. You have to really think about it and undergo it. Okay. So as I said, I'm going to talk about a very important aspect, it's a need of an hour, self-examination of breast. Not only cancer, sorry for the slide, बट ब्रेस्ट itself, it's not कि आपको कैंसर है इसीलिए चेक कर रहे हो. Everyone must do this self breast examination. इसमें कुछ नहीं लगता है, आप घर बैठे हैं, कहीं नहीं जाना है, किसी डॉक्टर के पास नहीं, किसी क्लिनिक में नहीं, किसी डायग्नोस्टिक सेंटर में नहीं. You have to do it by, you have to be your own doctor, you have to do it by your own self. घर किसी और की मदद से भी नहीं करना है, घर वालों की कुछ भी नहीं, आपको किसी को बताना भी नहीं है कि मैं ये कर रही हूँ या फिर ये कुछ है. या बट इफ यू आर डूइंग इट एंड इफ यू थिंक दैट इट्स अ गुड थिंग टू डू, यू मस्ट मेक पीपल अवेयर कि आपको भी ये करना चाहिए, इट्स अ गुड थिंग. क्या फायदे हैं अगर आप, इफ यू आर डूइंग सेल्फ एग्जामिनेशन ऑफ योर ब्रेस्ट, you detect lump at a very early stage, like I said, survival benefit, okay, better outcomes. आपको जो भी तकलीफ है immediately पता चलेगी. If you're not aware of your body, how will you know कि something is going wrong? People come with 5 centimeter, 8 centimeter tumors with us, to us. पता जब चला, अब भी 10 दिन पहले दिखा. मतलब आप देखते ही नहीं हो अपने आप को कि आपको पता चले कि आपके बॉडी में 5 से 10 सेंटीमीटर का ट्यूमर हो चुका है ब्रेस्ट में. कभी छुआ ही नहीं है कि पता करने के लिए कि कुछ तकलीफ है, मेरा निप्पल ठीक नहीं लग रहा है, ये ऐसा नहीं था पहले. यू हैव टू बी अवेयर ऑफ योर सेल्फ, विच इज अनफॉर्चुनेटली not very common thing in India, at least I can say, because I see a lot of advanced cancers, which is very sad to see. It's a very sad state of affair to see women coming with such advanced cancers. But awareness हमको create करना है और आगे चलाना है. So how to do self breast examination? First of all, you have to stand in front of the mirror. When will you do? That is important. किसको करना है, कब करना है? Age 20 years, और अगर आपकी फैमिली हिस्ट्री है तो 18 ईयर्स से स्टार्ट कर दो. एंड व्हाट यू हैव टू डू, व्हेन यू हैव टू डू इमीडिएटली आफ्टर योर मेंस्ट्रुअल साइकिल गेट्स ओवर. पीरियड जब आपका खत्म होता है, इमीडिएटली आपको नेक्स्ट डे में करना है. डोंट डू इन द पीरियड के टाइम पे, या तो फिर आपके प्री मेंस्ट्रुअल फेज में जो पीरियड आने के पहले का समय होता है उस टाइम पे मत कीजिए, बिकॉज उस टाइम पे थोड़ा सा वाटर रिटेंशन होता है ब्रेस्ट में. योर ब्रेस्ट बिकम्स हैवी, यू फील ब्लोटेड, बिकम टेंडर, आपको हाथ लगाने से दर्द होता है, या फिर मिड साइकिल में तो आपको दर्द होता है. तो ये टाइम पे आप मत कीजिए. सो द बेस्ट टाइम इज टू डू इमीडिएटली आफ्टर योर पीरियड गेट्स ओवर. व्हेन डू यू हैव टू डू? यू हैव टू डू एवरी मंथ. तो हर साइकिल में आप याद रखिए और कीजिए. दैट्स द बेस्ट थिंग. सो दैट्स हाउ इट इज टू रिमेम्बर दैट आपका पीरियड खत्म हुआ तो व्हाट यू हैव टू डू, एग्जामिन योर ब्रेस्ट. कैसे करेंगे? अकेले में आपको वेस्ट तक स्ट्रिप करना है. यू हैव टू स्ट्रिप एंड स्टैंड इन फ्रंट ऑफ द मिरर विद बोथ आर्म्स बाय द साइड. दोनों हाथ बाजू में करके खड़े रहेंगे. पूरा अपने आप को देखेंगे कि दोनों भी ब्रेस्ट सेम लेवल पे है, निप्पल सेम लेवल पे है. कुछ चेंजेस लग रहे हैं कि कहीं सूजा हुआ लग रहा है, सम spots are there, some redness is there, skin is puckered, the nipple is looking okay, it's not gone in, any dimpling is seen, is there a swelling in the neck, everything can be seen. Then arms by the side, दोनों हाथ को साइड पे रखें और फिर देखिए कि कोई चेंजेस दिख रहा है, आपके आर्मपिट में कोई स्वेलिंग दिख रही है, is there a something seen, very obvious bulge is seen in the breast or the armpit. Then arms above the head, दोनों हाथों को ऊपर करना है, आपके हेड के ऊपर डालना है और देखना है कि स्किन कहीं पकड़ तो नहीं हो रही है, कहीं खिंच रहा है, आपका निप्पल ऊपर हो गया क्या. इफ देयर इज अ ट्यूमर अंडरनीथ द ब्रेस्ट, अंडरनीथ द निप्पल एरियोला, it will get pulled up by doing this maneuver. And if there is a swelling, it will appear very obviously with this in the axilla also. अब ये हो गया इंस्पेक्शन, जिसको हम कहते हैं कि सिर्फ देख लिया आपने. अब क्या करना है? Now either you can lie down or stand straight, whatever is comfortable to you, and put one hand under the head, and with the other hand you have to palpate or see. अगर आप दोनों हाथ से उंगली और हाथ के अंगूठे के बीच में पकड़ोगे और ब्रेस्ट टिश्यू को पकड़ोगे तो हर चीज आपको गांठ जैसी और नोड्यूल जैसी लगेगी, बिकॉज द ब्रेस्ट टिश्यू इज फाइब्रोग्लैंडुलर, मतलब उसमें फैट है और ऐसे ग्लैंड्स रहते हैं which are like almost like round, so everything will be like a ball or like, you know, kind of a lumpy. So please do not do that. What you have to do is use the flat of your hand and do the circular motion like this, gentle pressure, not too much pressure, but ऐसा भी नहीं कि pressure लगाना ही नहीं है, gentle pressure so that it presses against the chest wall, the breast tissue presses against the chest wall, and you see with the circular motions कि ये इसके अंदर कुछ अलग चीज लग रही है कि मेरा ब्रेस्ट ऐसा ही फील करता है. इफ यू फील देयर इज समथिंग लाइक यू नो कॉइन काइंड ऑफ अ थिंग और लिटिल हार्ड स्टोन और लाइक यू नो बॉल काइंड ऑफ अ थिंग which was never there and now it has appeared, which is rolling under the fingers, then you have to immediately report to the doctor. Circular motion में फिर निपल से ऊपर की तरफ जाते हुए पूरे चारों तरफ you have to go up and down in the radial manner. Then you have to go up direction and down direction in the perpendicular manner, that you have to do the palpation, or you can say जो उंगलियों से मतलब हाथ से उसको टच करके देखना. So this is how you should do the self breast examination. Press your nipples and see if there is anything coming out. अगर कुछ डिस्चार्ज आता है, पानी जैसे कलर का है, येलो कलर का है, ग्रीन कलर का है, या तो रेड कलर का है. रेड कलर का इज वेरी वेरी अलार्मिंग, प्लीज डू नॉट इग्नोर इट. अदर कलर डिस्चार्ज ऑल्सो, प्लीज सीक इमीडिएट हेल्प. बिकॉज वो डक्ट ब्लॉक होता है, उसके नीचे छोटा छोटा गांठ बनने लगता है, देन इट लीड्स टू द कैंसर. So what you need to do is immediately show it to the doctors if it is any of the things are there present or you find कि कुछ भी इनमें से आपको लग रहा है, महसूस हो रहा है कि एक चीज चेंज हुई है जो कि recent change है. Now we see 40 is an important number. Why? All women 40 and older should go annual mammography because as the age advances the risk of developing cancer increases. So 40 से ऊपर, as I said, के नीचे को mammography नहीं करनी है, and 40 से above हर एक को screening mammography in India is not very common, but in abroad in US and all they have a mandatory thing to do an annual mammography जो कि वो लोग करते हैं. बट अपने यहाँ पर ऑप्शनल है, अगर आप चाहते हैं कि वो स्क्रीन करें, हम भी थोड़ा अवेयर रहें कि क्या हो रहा है, तो सेल्फ ब्रेस्ट एग्जामिनेशन एवरी मंथ कीजिए एंड डू एनुअल मैमोग्राफी. मैमोग्राफी रिड्यूसेस द रिस्क ऑफ डाइंग बाय कैंसर बाय 40%. मतलब ये इतनी जल्दी स्टेज में पकड़ लेता है कि हाथ में कैंसर फील भी नहीं हो रहा है, ट्यूमर फील भी नहीं हो रहा है, बट इट इज देयर विच इज डिटेक्टेड ऑन दी मैमोग्राफी ओनली. So it's a stage 0 cancer. Stage 0 has got 100% survival rate, correct? And her 1 in 6 breast cancers occur in between 40 to 50 years. तो ये जो एज ग्रुप है ये बहुत ही important है, समझे? Then again the thing, early detection saves life and survival benefit of 40% is there if it is detected very early. Okay, so keep calm and fight on. ऐसा कुछ नहीं है कि somebody has got breast cancer तो उसका डेथ सेंटेंस हो गया है, वो कुछ नहीं जी पाएगा, अब उसकी जिंदगी खत्म हो गई है. People live for like 20, 30, 40, 50 forever. They die of other causes than the breast cancer if they were treated for breast cancer earlier and they're breast cancer survivors. We call them fighters, not survivors. Okay, because they have the courage to fight on. And please show your support to such people. They really have struggled, they have really undergone a lot of trouble in the treatment, and the coping up with the stress of knowing that to have a cancer and to fight with it, and to undergo a surgery, to undergo such difficult treatments like radiation and chemotherapy, which are not like very easy to tolerate in some patients, especially in the elderly and with people with comorbidities, with the diabetics and heart diseases, everything. बहुत सारी रिस्क चीज़ें बढ़ जाती हैं, हर चीज़ की सर्जिकल रिस्क बढ़ता है, कीमोथेरेपी का रिस्क बढ़ता है, जिनको कार्डियक इश्यूज होते हैं कि रेडिएशन बहुत बड़ा वो होता है उनके लिए मसला. सो इन सब बातों को वो लोग ने टाइड ओवर किया है. दे हैव अंडरगॉन ऑल दिस थिंग्स इन स्पाइट ऑफ हैविंग सो मेनी इश्यूज. दे हैव अंडरगॉन द ट्रीटमेंट एंड दे हैव बीन एबल टू अचीव द क्योर रेट एंड द सर्वाइवल बेनिफिट. सो प्लीज डोंट बी अंडर दिस थिंग के कैंसर पेशेंट है मतलब वो तो बेचारा गया. Instead of degrading such people, you need to show your support and work with them. You need to find a support groups for them so that they encourage others also to undergo treatment. इंडिया में इतना ट्रीटमेंट की कमी है, लोग आना ही नहीं चाहते, बाहर निकल के बताना ही नहीं चाहते, और इतना एडवांस हो जाता है जब तक कि कोई फाइंड आउट करता है और उनको बताता है कि ये बीमारी हुई है. So let's defeat breast cancer together. Not only the patients, everybody, whoever's around, family, friends, in general population, please show your support to cancer survivors and help the organizations like Cancer Aid and Research Foundations. They are doing tremendous job. Okay, thank you for the patient listening. Any questions I would like to take in the comment section, you can drop your questions. It was really nice to talk about it. Any query anybody wants to know, I will be happy to take questions. There are some question. Is there any diet to control breast cancer? Diet as such is not for the control. You have to reduce weight. You have to maintain healthy weight. Obesity is a risk factor. No specific diet. Is there a 5 stage in breast cancer? No, 4 stages. As I think I was very clear with the stages of breast cancer. There are no 5 stages. There are 4 stages, and the fourth stage is the last stage where the cancer is spreaded to the other parts of the body apart from the breast. Like they've gone to the either the lung or the liver or the brain or the bone or any other organs like that. Neha, I would like to answer that it depends on everything. It depends on hormone. If you want to take immunotherapy and everything, it depends on what your doctor has advised. Because you're on this, I really cannot comment exactly what the stage in with without seeing the patient and without seeing the histopathology reports and everything. That what is to be done. Unfortunately, if she got infected with COVID and everything, but I'm sure there are other modalities. And stage 3, yeah, you need to be little aggressive. Radiation is advised, which you really need to take, I guess, because if you don't do complete treatment, then the chances of recurrence are very high. What are the types of breast cancer? Types, if you want to know, then there is carcinomas, sarcomas, or there's something called Phyllodes tumor. Phyllodes tumor is it's a sarcoma phylloides, which was the other name, which is a misnomer. It's not a sarcoma. It's a different kind of a tumor altogether. But I have not touched upon that. There the treatment modality is totally different and not like this. What I have talked about is basically the carcinoma or the invasive or carcinoma of the breast. I have not touched upon the in situ carcinoma or the DCIS, what we call ductal carcinoma in situ. I have not touched upon that because the modality of treatment is a little different in that. So what I have talked about is basically what is the most common breast cancer is. Rushika's question is how frequently can we do mammography and after what age we should do. I think I have answered this question, Rushika, that if you have a family history, then the 10 years prior to the index patient or the case, you have to start doing your mammography every year. And in general population, I would say after the age of 40 years, and again you can see invest, they do annual mammographies, but in India we don't do that routinely. We can do once in 2 years, or we can say once in 3 years, for once a year at least for 5 years, then once in 2 years for another 5 years, and then once in 3 years till the age of 65 or something. I hope this was clear. Sorry, I'm not touching the oral cancer over here, so I don't want to answer this. Okay. Symptoms and signs, I have mentioned that any lump, not every lump is cancer, but you have to be alert. You can't just ignore it, because I don't know what's the matter in Indian women. They don't like to go to the doctor, or they are very shy, and they don't, it's such an organ that they don't like to show it to. I think most of the surgeons in their belief are men, but it's not true. Many women surgeons are also there, so you all are most welcome to go to the women surgeons, where you can go and show. And please don't hide it away. Don't think that it's a stigma to have a breast cancer like that. So please, early detection saves lives. Yeah, Afreen's question is a woman at risk of cancer who was on hormone treatment for a long time. Yes, hormone replacement therapy or the oral contraceptive therapy for a long, long time is a risk factor for development of breast cancer. So that needs to be, and all these things need to be used with caution. Is next question is self breast examination can really help in preventing breast cancer? Preventing as in early detection, it can't prevent, nothing can prevent, but early detection is the key. See, you saw the tremendous change in the survival rates. Like stage 4 has 20% and stage 1 or 0 is 100%. So if we are doing a self breast examination, we are detecting a lump maybe of a size of a peanut, you know, and person who is not aware of her breast will not see the breast and will come with a tumor which is size of a orange. So that makes a difference, I guess. Thank you for the question. Are there any questions, or I think are there any more questions, or should we close the session? So it was nice to talk to everyone. Hope we'll have more sessions, and if there are any other questions, you can drop in the comments section. I can answer that later. Okay, thank you. Hello. Yeah, I would like to introduce the next speaker. The next session would be on 30th of December by Dr. Tushar Jadhav. He is the surgical oncologist. He's a consultant at Reliance Hospital, Kopar Kherne, Navi Mumbai. He is basically a director in Mumbai Breast Care, and he's done his MCH breast oncoplasty from UK, and he was a clinical fellow at Breast Cancer Services, Tata Memorial Hospital. He's done a national fellowship in palliative medicine, and he has a EBSQ breast surgery qualification as well. So I hope, and he's going to talk about the recent advances in breast cancer. So what I did was a very basic informative thing with you all, that what is the breast cancer and how to go about it, and I have not touched upon much upon the recent advances, the recent treatment plans, and the recent treatments. So then Dr. Tushar is going to talk about it. So hopefully it will be useful for you. Thanks for listening. I am Dr. Almas Khan. Thank you. Thank you for the patient listening.